Now we're going to turn our attention to, we've heard strategy and the breadth of challenges at the executive leadership level. We're now going to dive in deep. I just want to highlight the last point that came up was an issue of trust. And in the context of contact tracing and virus mitigation, this next panel, I think, has a trust issue to talk about. So I'd like to introduce Kameka Dempsey. She's the founder and CEO of KD Leadership. She's a highly sought after expert on the intersection of business people and DEI strategy in the workplace. And Kameka, take it away, please.
Thank you, Andy. And I'd like to thank all of our panelists for joining us in our conversation today. Our panel is going to be a quick one for 30 minutes, and we have a pretty audacious topic to cover, which is virus mitigation with the context of safely opening schools. And so I'm going to just briefly give, a quick introduction to each of my fellow panelists today, and then ask you to, just give us the 30-second headline about, how you come to this particular topic today. So I'm joined by Andre Fenton, who's a professor of neuroscience at NYU and also an active participant in Black in Neuro. Dr. Thomas McGinn, who is the Deputy Physician-in-Chief and Senior Vice President at Northwell Health, and also Chair and Professor of Medicine at Hofstra/Northwell. Also, Dr. Kamilah Jackson, who is Medical Director at PerformCare New Jersey. She's a double board certified adult, child, and adolescent psychiatrist, as well as a member of the National Institutes of Mental Health Advisory Panel. And lastly, Barry Svigals, who is F.A.A.C.A.P founder and partner emeritus at Svigals and Partners, and this year is a Stanford D.School K-12 Lab D.School Fellow focused on reimagining school safety. So thank you again, panelists, for joining us. Why don't we just do a quick around the room to hear a little bit more about how virus mitigation is impacting the work that you are doing. So why don't we kick it off with you, Andre? Andre.
There, I've unmuted. Hello, everyone. Thank you for having me. Before COVID and during COVID, I'm a neuroscientist running a fairly aggressive research program in a department that focuses on research alongside our teaching. Because of the pandemic and we had to shut down our laboratory, I became involved in a bunch of different things, a ventilator project early on, and then started to focus on how do we reopen our laboratory, where many of our concerns in the research community are not exactly the same concerns that the education mission at NYU has. And so that has led me to learn and apply all the skills that I have from some entrepreneurial activities in trying to figure out a program to allow us to continue our research mission in light of the education mission and the mitigation efforts.
Great, thank you. And why don't we go to you next, Dr. Kamilah Jackson?
Good afternoon, thanks for having me as well. First, I just want to say how excited I am here to talk about the mental health impact of things. I currently am focused on children and adolescents and supporting their psychiatric needs. And certainly in this acute phase of the pandemic, the focus has been on the physical healthcare side of things. But as someone who works with a population of kids trying to access treatment, I've certainly seen the impacts of, for example, not being able to access care in quite the same ways we were able to before the pandemic. I've also seen some good things happening in terms of the waiver of some of the regulations around telepsychiatry, for example, and telehealth. That's really provided new opportunities in ways that did not exist prior to the public health emergency.
Great, thank you. Barry, why don't we go to you next? You're on mute, Barry.
Thank you, Kamilah, and I'm delighted to build upon what Dr. Jackson was saying. And I think it's wonderful that we're trying to get kids back to school, by the way, and focus on the virus. I would take a step back, and we have in our research at Stanford, and look at safety from a broader perspective. And understand, first of all, that being safe, in other words, protection from physical harm, is not the same as feeling safe.
And understanding that difference, or the failure to understand that difference, has serious consequences to defining the problem of how we go back to school, and what needs to be considered in coming up with any of the solutions that kids will be experiencing when they go back to school. And this will impact the quality of their learning, as well as their well-being. And so I would expand the mental health bracket to one of well-being of all the students, and it isn't simply the economic impact that they're facing. And I'll talk a little bit later, hopefully, about how we came to that and how it's very much like how we looked at safety singularly before this crisis. Just 6 months ago, our national obsession was extreme and extremely rare instances of gun violence. And our approach to that was as wrongheaded as some of the approaches that we're seeing right now. So I hope you have a chance to look at those, but thanks for having me.
Great. And then lastly, Dr. Thomas McGinn.
Great, thanks for having me, and great topic. I am a primary care internist, but happen to also oversee New York's largest health system physician group and led us through the COVID challenge during the peak, where we had the largest number of COVID patients. I am also a data scientist and looking at some of the downstream impacts of COVID on patients as they recover from COVID, and been working with a lot of the schools in the New York area to think about opening, as we have opened up hundreds of ambulatory sites and clinics, and thought all the way through what that means, and a lot of deep dives on testing and accuracy of testing and what that means and how that helps you open up or not open up, the implications of all that. So obviously from us, we're the largest employer in New York State, and having our schools open here in New York City enables us to run our health system. And we are vested in this and want to help in any way we can as a large health system with a research engine attached to it. So.
Great. So just for our listeners, want to frame the conversation a bit and really talk about, when we talk about virus mitigation traditionally so far, what we've been hearing is really that it focuses on 5 key components: contact tracing and or exposure notification, which might be the traditional definition of contact tracing that public health experts have used over time, alongside some of the newer technologies that we're seeing in terms of exposure notification that are custom-built apps that we are using for this current pandemic. The second is testing, and really mounting testing at scale. And then the third element would be isolation for those who have been exposed or for those who have been determined to have COVID-19 and receive a positive test result. And then isolation for those who, I just mentioned that, but then behavior change and adoption. And I think particularly when we're talking about schools and safely reopening schools, behavior change and adoption goes much beyond, the traditional hand washing, hand sanitizing, mask wearing, social distancing, frequent environmental sanitation. It is really about how we actually think about how students, whether they be in the K-12 space or the higher education space, are actually going about their day. How do they get there? And then lastly, the support for the mitigation of the virus for those impacted by the virus, as well as isolation and reinforcing behavior modifications that hopefully will be able to flatten the curve. Again, an increased complexity to this very complicated issue is that we have differing school types. So we have public versus private, we have K-12 versus college, university, online and remote. We have student types, whether they're elementary school students, middle school students, high school students, college students, graduate students, special needs students, you name it. The school location, whether you are located in an urban area, if you are in New York State, as you just mentioned, Dr. McGinn, being downstate in areas like New York City and Long Island is very different than being upstate, whether you're in a suburban area, a rural area. The learning modality, Charlton spoke earlier about, there are going to be a variety of different ways in which people will think about returning to school, whether that's 100% online or remote, whether that's some hybrid model of a mix of online and in person, or whether it's a full reopening of 100% in person. And then the various constituents within the school ecosystems. That's family, whether they're multi-generational homes, single families, etc. The staff, all of the teachers, professors, support staff, lab staff, as Andre just mentioned, transportation partners, depending upon where you are in the United States, that might be very different. After school and before school care partners, nonprofit organizations, and extracurricular activity leaders. So given this backdrop, you know, it's a very, very, very complex issue that we are trying to tackle. I'd like to start with, you know, how you're thinking about advising individuals to think about this first element of contact tracing and exposure notification, because as recently as this morning, you know, NYU has an example of they are going to be testing ad hoc, you know, sort of randomly selected populations, whereas Yale recently updated yesterday that they're going to be testing students now every 2 days, as up from every 5 days. And, you know, we heard in our last panelist, you know, there are some different approaches that we hear from both CUNY and from a small private school like Cheshire Academy. So would love to know, you know, what are some of your thoughts about that?
That was a handful.
It was.
Yeah, just a whole universe of everything. You know, I'm going to drop in a quick comment about testing, and this is not specific to schools, but you know, one of my backgrounds is test accuracy, and we need to be very conscious of the fact that there are so many different types of tests that vary in their accuracy, and their accuracy will vary by their geography. Now, that's something people do not appreciate. So that in New York, as of today, a negative test on most average tests is a trustable negative. A negative in Florida today is not very, you can't trust that negative because the prevalence of the disease is so high. So we need to be sophisticated about our test results. So for example, a positive test in New York is more likely 30% chance on the best tests to be a false positive. You will then put people in isolation for 2 weeks for potentially 1 out of 3 positive tests. All these things kind of come into play as you think about these things, and we can't use the test as a holy grail. We have to appreciate how to use that test. So I'm just going to put that out there for people to think about a little bit and chew on as they try to solve what you already set up was so complicated.
Yes, yes. And just on that point, you know, I'd be curious to know, I think when we're talking about, you know, this whole event today, really highlighting some of the access and inequality issues that come to mind. And, you know, when we were sort of I'm in New York City as well, when we were in the height of the pandemic back in March and early April, you know, there were some serious issues with respect to access to testing. So while it might be that we had accurate tests, getting access to those tests was increasingly difficult. And if you think about opening schools safely, on some level, people will want to rely on access to testing as a means to do so. So can anyone really sort of address what your thinking is on that and what kind of guidance you might provide?
Well, I'll let others speak on this. I have comments, but Andre.
So I'll jump in. I may have the easiest problem to solve of this group because we decided to try and solve not NYU's problem or not New York City's problem or New York State's problem, just the Meyer building of NYU, which has about 350 people. And so that became a really big concern for us. If we wanted testing, and I very much appreciate your comments about base rate neglect. You need to know what the baseline rate of finding what you're looking for in order to interpret the test result. So how do you get everyone access to the test? And we've really, just looking around New York City, had to settle on, we have to bring the test to the building. And so we contracted a physician group to come and set up so that it would be accessible to everyone. Because when we polled the various people in our community, it was not really straightforward how everyone would get access to places where they could go and actually get a test. So I can imagine this becomes a giant problem when you try and grow that for for a big population.
I think on the last panel, it was said that the decentralized method does not work, and it does not work. Right now, so we're all going to be competing, and based on our ability to purchase and acquire is really going to win the day, and that's just not the way to do this. And frankly, that's how it's worked. You know, who has the strongest procurement officer that has the biggest contacts that can get the materials that are needed for testing are going to win the day. And we can tell you that those are those that typically are of higher socioeconomic, you know, and the hospitals, the schools all have the same, you know, power and ability based on their economics. So this is not the way to organize it, but sadly that is how it's organized, and it is unfair. It does cause disparities, inequities that we see play out in front of us. And I don't see any change coming down the line, to be frank with you, in the fall.
Mm-hmm. Yeah.
And so shifting gears from, you know, testing as one means to think about virus mitigation and transitioning to this idea of isolation. Now, isolation in terms of thinking about safety with respect to opening schools might look different. It could be that it's the traditional sort of 14-day quarantine isolation for someone who is symptomatic, but I think also isolation comes very much into play in classrooms, whatever they might be. And so Barry and Kamilah, I'd be really interested to hear, you know, what your thoughts are on how do we actually address issues around isolation with respect to education and creating an environment in which we are asking children of a variety of ages to be then sponges to learn information while also doing something that's quite different than what they had been used to previously.
Dr. Jackie, you want to begin?
Well, I was going to say, I'd love Barry to start from a climate perspective, because I really love your contribution about that, by the way. I think oftentimes when mental health folks are brought in, it's very specific, sort of people are thinking treatment, diagnosis, but I really see things more broadly, particularly as a child psychiatrist. I'm thinking of opportunities for health promotion, prevention, early intervention before we get to the stage of needing to diagnose things. And so from what I know of your approach and that climate orientation, that's really, I think, where things need to start, particularly when thinking of the education environment. And I'll offer some thoughts after you do around the space and thinking about that.
Well, what's interesting is, of course, as architects, when it's like if you give architects a problem, it's like giving a dog a bone. They'll go after that one single problem, how to do isolation, and all the solutions that we've seen thus far have been aimed right at that, say, have the desks apart. I think what we need to do is take a step back and say, what is the larger issue here, which is learning? And it's extraordinary that before, even with respect to gun violence, we were looking at protecting students from, as I was saying, a very rare occurrence of gun violence, while you had last year alone, over 6,200 students committing suicide, over 160,000 kids staying at home every day because of bullying. So where is the problem in this? And it is true extraordinarily with combating the virus as well. And what we see is these strategies need to also include simply the question of how is this affecting learning? And not only that, even better perhaps, how can we do testing that enhances learning? If we pose that problem, we'll solve it. We can be creative about this. And in every interface, there is that opportunity to step back and ask the question from a different perspective, which is, how can we enhance learning? How will different students be affected differently? Mm-hmm. Because not everyone is going to like the tests in the same way, as we well know, just in the last panel, everyone's going to have a different take on what risk is. And lastly, how is it going to enhance well-being? How is well-being being cared for in the way in which we do these things, not just the thing itself? Because I think we have so many wonderful solutions, but they need to be in the embrace of learning and the well-being of the kids. And I know, Andre, you're going to be able to talk about how traumatized kids do not learn. They cannot learn in the same way. You know this very well. So there it is. If we're traumatizing kids simply by all the things we're doing, all the protocols are traumatizing. So I'll stop with that. But there are some solutions to it that I think are interesting.
Yeah. And I think to that last point, I've only seen some early surveys, but certainly kids K through 12 college age are feeling anxious, right? The adults are feeling anxious as well, not surprisingly. The kids are also. I think, you know, the resource issue that was posed earlier is also very critical here. So I'm sitting here in Philadelphia, where classroom size was an issue pre-pandemic, and how they can even do some of the protocols around spacing is a major issue now, and to contend with going into school in September. I think part of the challenge, though, is who all kids are in school, right? So to your point, Barry, some kids have significant, you know, special education needs, for example, for whom school is the connection point for them for those types of resources. And so we know that for those young people, their parents have been really struggling at home because they don't have access to the daily supports that they did inside the building. Schools are also places where kids get identified with having particular needs. It's where they spend most of their life. And so without the opportunity for other adults to see them, issues like child abuse and neglect, anxiety, depression, all of those things, suicide in particular, it's the second leading cause of death in the 10 to 34 age group, and seems to have been increasing in that age group as well over time. So really significant challenges. And right now, I think as we had to cobble things together to create virtual learning, those virtual supports didn't go along with it, right? So I think that's a huge challenge for thinking about reopening.
Is it, sorry, go ahead.
No worries. I just wanted to be mindful of time and hopefully get a chance to take a Q&A question if people in the audience have questions, but also want to think about the learning ecosystem and adaptation of behavior that's needed to be taken on by the whole ecosystem. So it's not just students, it's also all of the people in the buildings, whether they be campuses or they be, you know, primary school locations. And so Andre, just curious, you know, what are some of the things that you're starting to see be implemented with respect to actually adopting those new behaviors?
So again, my problem, or the problem that I've formed for ourselves to tackle, is small. It's 350-ish people, but these are the research staff, the faculty, the trainees, and some students. And along the lines of what you said, is we've had to think of the entire, from end to end problem, and exactly that. How do people, the first thing I can tell you is that nobody wants to be tracked. Nobody wants to know that someone is watching them. It makes them feel anxious, and it should, because under normal circumstances, it does. No one wants to feel that they might be isolated or the source of causing a laboratory or the building to shut down. This itself is anxiety provoking. So but we're in this sort of stymie, if you will, of we want this information, but we're afraid to actually participate in collecting that information. And that's what we understood by talking to the various people, groups of people in the building. And in fact, Michael Roth before said, you know, fundamentally there was a problem of trust or lack of trust. And in fact, that's where our solution started. So I've learned about blockchains, and I think about them as a way to produce, if you will, an artificial, but a trust of at least information amongst agents who don't need to trust each other, or who might not trust each other. So we try to build our program out, trying to respect people's deep, deep need for privacy, and their suspicion of authority collecting this information that's very personal and, you know, protected by law. And so we ended up using a blockchain system in order to collect and manage that information, where the information only exists, if you will, with a digital ID within the system, but not outside of the system. And I can't tell you that that's going to work, but that was one of the very, very salient points that we recognized very quickly. Everything we were trying to do was actually producing anxiety and disruption. And we had to find a way to try to manage collecting that information in a way that respected privacy.
And Barry, what are some of the ways that you all have been trying to create support systems for adoption of the behavior out at the D.School?
Well, I would like to give a shout out actually to a group called Playworks and Jill Violette. They're coming out with a book, workbook next month, which is just fantastic. And they look at play from a whole different perspective, that the opposite of play is not work, it's depression. And if in the absence of play, we don't thrive. So they're looking at all the protocols from the point of view of a game. For example, they have a game that's called Spin Master. A student is given the authority to be the spin master for a day. And for half a dozen times they can say spin. And when they say spin, everyone has to put out their arms, do a 360-degree turn, and everyone is separated. It does a number of things. It seems like a simple thing, but what it does is, one, it unifies the kids, gives agency to the students, which, by the way, they need to be in the conversation about how these solutions are being done. If they're not, they simply will not be as effective. We know this to be true. So in that just little simple exercise, it's a game. They're not traumatized by the fact that they have to stay 6 feet apart, as opposed to a piece that was in the news just the other day from Korea, where a student was interviewed coming off the bus. She said her experience was 30 teachers were shouting at her saying, stay apart. Now, the effect that has on kids obviously is not particularly good for anything. So I think, again, going back to, if we frame the problem in a different way, and as Andre was sort of suggesting, that the other side of this testing is how people feel for it. If someone's getting a gun under their head to get their temperature, there's an effect. How can we think about each one of these pieces? And I think we can, in ways that are more inventive and serve these multiple purposes of learning, well-being, and equity.
Great. So I see Andy has returned, which means that it's time for us to wrap up. So what I would love for each of you to do quickly is to go around the virtual room and please share one very pragmatic tip or question for consideration as school communities think about safely reopening and mitigation of virus spread that you would like to share. So why don't we start with Andre?
So one of the things that I didn't pay much attention to at first, but recognized was very important, is to figure out the economics of this. And it's very surprising when you take an entrepreneurial view, where what looks like you have no resources becomes a very big resource because you are a customer.
Great. Barry, what about you?
Well, I would go back to what I was saying earlier. If you begin with the right questions and frame your problem appropriately, the need appropriately, you will come to very different conclusions and very different solutions. So ask the question of learning. It's all about learning, equity, and well-being.
Great. And Kamilah, how about you?
I would say, like you're doing today, keep social emotional health and behavioral health for young people at the table, because I think we are at very high risk of having this be the next wave of challenges that comes out of this.
Great. And last but not least, Dr. McGinn.
I think it was mentioned a little bit about we've involved our nurses, our clerks, our janitors, and our in the solutions. So they were really invested in it. And I think if we do that with our students and trust even the kindergarten kids to think about what do you want to do, like engage them in a cool project that's going to get them excited, then they're going to buy into it and they're going to celebrate it together. And that camaraderie was so important in healthcare. Everybody was so involved and so excited. Imagine we could tap into that for kids, like really tackling this as something together and they're excited about it. I think we could really jazz it up a little,
Absolutely. So I just want to say thank you to all of you. I think we could have, easily had a 2-hour, 3-hour, 4-hour conversation with each of you, because this issue is really quite quite challenging and very complex in a variety of different ways. I want to thank you all for being part of this conversation today, because it is really important to make sure that this is not the beginning of a conversation, nor is it the end of a conversation, but actually one of many that is to come on this topic, because as we know, the data is changing daily. We've had 150,000 deaths, unfortunately, in this country, and there will be more to come. And so thank you again for your participation. Andy, back over to you.